Good morning, everybody, and thank you to EHA for selecting this work for both the press conference and the plenary session. So this is a new large Phase III international myeloma study. The purpose of the study was to assess the clinical benefit of adding Isatuximab, which is an anti-CD38 monoclonal antibody, to what we call the Bortezomib, Lenalidomide, and Dexamethasone, so the VRd regimen for transplant-ineligible patients with newly diagnosed multiple myeloma. So I have nothing to disclose. So just to start with 3 comments. The first comment is to say that we have established triplet regimens in the past few years for newly diagnosed myeloma. The VRd regimen is one of them, but you may find also other regimens. The second point is to say that there is still an unmet medical need for the elderly patient with newly diagnosed myeloma. So these patients still have an inferior clinical outcome as compared to the younger patients. And finally, we have established recently what we call quadruplet regimens combining an anti-CD38, Bortezomib, Lenalidomide, and Dexamethasone for transplant-eligible newly diagnosed multiple myeloma. So this study is the first study combining a CD38 with VRd for transplant-ineligible myeloma. So this is the study design. So the study is a global randomized international Phase III study for registration. So we enrolled 446 newly diagnosed multiple myeloma patients below the age of 80 years, 265 in an Isa-VRd arm and 181 in the VRd arm. So the treatment schedule had 2 parts, an induction part with 4 6-week cycles, followed by continuous therapy with 4-week cycles. The primary endpoint was progression-free survival. So here are the study results. So this is a summary of study results. So Isa-VRd followed by Isatuximab-RD led to a statistically significant improvement in progression-free survival. Deep response rate with statistically significant improvement in complete response on MRD negative complete response rate were observed. Improvement in MRD negativity and most importantly, sustained MRD negativity. Quality of life was maintained over time with no negative impact due to the addition of Isatuximab, and finally, a safety profile consistent with that of each drug. Just to illustrate the primary endpoint, so this is the PFS. So the median follow-up is approximately 5 years. We have seen 162 PFS events. The median PFS was not reached for the Isa-VRd arm and was 54 months for the VRd arm. The 5-year PFS rates are 63% for Isa-VRd and 45% for VRd. The hazard ratio is 0.59, representing a 40% reduction in the risk of progression or death. So these are the conclusions. So this study, the first Phase III study to add an anti-CD38 monoclonal antibody to the VRd backbone in transplant-ineligible patients. Isa-VRd followed by Isa-RD showed improved efficacy over VRd followed by RD with a consistent safety profile. We observed deep response rates, including for MRD negativity, and finally, these study results support the use of Isa-VRd as a new standard of care option for frontline disease control in patients aged less than 80 years with transplant-ineligible multiple myeloma. Thank you very much for your attention.